Welcome everyone. We are very thankful to Dr. Snigdha ma'am, who has spared her valuable time for teaching us on an important topic. I would like to say a few words about Dr. Snigdha ma'am. Ma'am received her teacher's training in pre and postnatal exercises in USA from Elizabeth Noble ma'am. She is the only physiotherapist in India to be certified by American Physical Therapy Association for obstetrics and pelvic physiotherapy. Her obstetrics certificate include Advanced Technique in Labor Support from Baltimore, Fundamental and Advanced Pregnancy and Postpartum Physical Therapy from Houston, Pelvic Incontinence Certificate from New York, Pelvic Pain Certificate from Portland, also Bowel Dysfunction Certificate from Portland. She has received training from more than 20 international renowned physiotherapists like Diane Mulligan, Shirley Salmon, advanced level, and also in kinetic control level 3 and others. Her physiotherapy center has been nominated as the best 3 physiotherapy centers in Mumbai for both 2019 and 2020. We are very thankful to ma'am for sparing her valuable time in teaching us. Thank you, ma'am. We are obliged. Please, ma'am.
Thank you. Thank you so much for that wonderful introduction, Dr. Brijesh Kapoor. You are doing exemplary work in the field of physiotherapy, and I'm so proud of the kind of work that you are doing.
Thank you.
I got interested in this topic of, can everybody hear me? And yeah.
Yes, ma'am.
Okay. So, just a minute. There's somebody who is now full screen. Gokulan Kaman.
Ma'am, what you can do is, I think if you start your presentation and then you can make me the host, then I can keep admitting and you will not be disturbed. I think this works like that. So you can continue with your presentation, but you must start your presentation first one time.
Okay, I'll do that. So I'm sharing screen.
Yes, ma'am.
Yeah. Okay.
Yes, ma'am. We are able to see the screen.
Yeah, you are able to see the screen?
Yes, ma'am.
Just a minute. Okay. Dr. Brijesh Kapoor, can I request you to put your video on
yes, ma'am. Yes,
shut?
yes, ma'am.
I can't see myself on the screen.
I'll do that, ma'am. Not a problem.
Thank you so much. Can you make me the? Is it possible to show me on the screen, Prabir?
Yeah, you are on video and your presentation is also visible.
Okay, I can't see myself though.
Yeah, you may have to show yourself, but I can see you, and you're the only one who is on video.
Okay. Anyway, I can't see myself, and some. Okay, so we will begin. Okay, so this topic of gut-brain axis, I was very excited to learn about it just a year back when I was in USA and I did the bowel dysfunction course. And I always had in mind that, I would like to speak something about it because it's really excited me. And the scope that we have in future with the knowledge of the gut-brain axis. So when Dr. Brijesh Kapoor very kindly requested me to speak on a topic in physiotherapy, I suggested to him this topic, and of course very kindly agreed to the topic. So here we go. We've always known there's a connection between the gut and the brain. Haven't we sometimes had a gut-wrenching experience, or felt nauseated before giving a presentation, or felt intestinal pain during times of stress, or felt butterflies in our stomach? We've often felt all this, but we didn't know why. Because hidden in the digestive system, this brain in our gut is revolutionizing medicine's understanding of the links between digestion, mood, health, and even the way we think. Scientists call this little brain in the entering nervous system, and it's really not so little. The enteric nervous system consists of more than 100 million nerve cells lining our gastrointestinal tract from esophagus to rectum, and our two brains talk to each other. 24/7, there's a hot line between the digestive tract and the brain, though they are far apart in our body, and this biochemical communication set up by special nerve cells and immune pathways. This communication system between our gut and brain is called the gut-brain axis. Recent studies show that our brain affects our gut health and our gut affects our brain health. The gut-brain axis involves constant complex crosstalk between the neuroendocrine system, the immune system, and the autonomic nervous system. These two organs are connected in both directions, physically and biochemically, through the vagus nerve, which is the fastest connection between the gut and brain, and the neurotransmitters, the chemical messengers like serotonin, dopamine, and endorphins. Now let's learn a little about the gut microbiota. Many of these neurotransmitters are produced by our gut cells, and these microbes are called the gut microbiota. Gut microbiota are millions of microorganisms composed of 500 to 1,000 different species like bacteria, viruses, fungi found in the digestive tract. The composition of this microbial community is host specific. That means each of us could have a different kind of a microbial composition and may change by both exogenous and endogenous stimuli throughout our lives. What are the factors influencing gut microbiota? Antibiotics can change the composition of the gut microbiome radically. The good and the bad both can be changed with antibiotics. And that's why we have to be more careful about taking antibiotics. With age, our gut microbiota changes. What kind of birth have we had? Whether we've had a normal vaginal delivery or we've had a C-section or a cesarean. During pregnancy, yes? You can hear me, right?
Yeah, we can hear you clearly.
Okay. During pregnancy, our gut microbiota is very important. It is as a transmission from the mother to the fetus. Stress can change our gut microbiota radically. Genetics can change it. Nutrition can change it. And of course, exercise can change it. The composition of gut microbiota begins to take shape at birth and continues to do so during lactation. Babies born by cesarean section have different gut bacteria to those born vaginally, but the differences largely disappear by the time the babies are 6 to 9 months old. So there are some terms that we will be using. What is the difference between microbiota and microbiome? The microbiota describes the actual bacteria that are there in our gut, and the microbiome is the bacteria and their genes. but these terms are often used interchangeably. This gut microbiota is a key player in the bidirectional communication across the gut-brain axis. Gut-brain axis is the key regulator of neural function and stress response. So it's not only the gut-brain axis, it's the microbiota gut-brain axis, which is the key regulator of our health, and not only human but animal health. This microbiome communicates with the brain through neurotransmitters in the gut that signal directly through the vagus nerve and indirectly through hormones and or the immune system. What else do the microbiota do? These gut microbiota has emerged as a chief player in health and disease and against pathogens, aid in digestion and nutrient absorption, produce vitamins K and B, boost our immune system. In short, the gut microbiota play an important role in both physiology and psychology of the human body. A famous gastroenterologist, the director of University of Washington Center for Microbiome Sciences and Therapeutics, Dr. William De Paolo says that the role of microbiome in health and disease is an exciting area at the forefront of science, but the field is still in its infancy. Thus, a new branch of medicine is fast emerging. What is a healthy microbiome? A healthy microbiome is a diverse microbiome. A rich community of varied species protects against one that is dominating and causing trouble in our gut. A diverse microbiota profile is associated with enhanced vitamin production, short-chain fatty acid production, dietary fiber metabolism, and disease protection. What is the function of short-chain fatty acids? These are organic compounds produced by the gut bacteria from tough-to-digest plant fibers in our diet. Collectively, they are the major source of energy for colon cells. These short-chain fatty acids influence gut-brain communication and brain function directly or indirectly and are speculated to have a mediational role in microbiota gut-brain axis crosstalk. SCFA butyrate beneficial in metabolic health. Genetic material of the microbiome is approximately 150 times greater than the human genome, which has led some scientists to label the microbiome as a superorganism. So what is dysbiosis? Dysbiosis is the loss of bacterial biodiversity, which can trigger common health problems. When dysbiosis affects the gut, the communities of beneficial and benign bacteria that usually make up the microbiota are altered, leading to digestive symptoms and physical, emotional, and problems with behavior. These are a whole lot of problems, health problems that we can get because of dysbiosis. From obesity to diabetes to autoimmune disease to cardiovascular disease, irritable or inflammatory bowel disease, ulcerative colitis, multiple sclerosis, asthma, colon cancer, Parkinson's disease, Alzheimer's, chronic fatigue syndrome, alcoholic liver disease, non-alcoholic fatty liver disease, depression, autism spectrum disorder, schizophrenia, endometriosis, bacterial vaginosis, and many more. So dysbiosis can cause immense number of health problems that we can suffer. The gut microbiota is emerging as important in the management and prevention of inflammatory and metabolic disorders. Some studies described in this Journal of Nutrients have described that the gut microbiota of obese humans exhibits a higher Firmicutes bacteroidetes ratio compared with normal weight individuals, proposing this ratio as an eventual biomarker of health. As you see in this obese gentleman, the ratio is much higher of Firmicute and bacteroidetes, whereas in a lean individual, it's a smaller ratio. So this could be a very important biomarker of health. Exercise. We all know that exercise is very important for health. But why is exercise so important for health? We are still discovering. So what is the impact of exercise on the gut? Exercise increases the number of beneficial microbial species, enriches the microbial diversity, enhances the short-chain fatty acid synthesis and carbohydrate metabolism, decreases the Firmicutes bacteroidetes ratio, helps in weight loss, reduces intestinal transit time, and changes stool consistency. So it has a great impact on the gut. So exercise can modify the gut microbiota both qualitatively and quantitatively and influence host physiology with beneficial effects on the metabolism, immunity, cognition, behavior, and overall health. Dr. Jeffrey Predis from the American Gastroenterological Association Center says that although our understanding of how exercise affects the body remains incomplete, some of the many factors that might trigger responses from the gut microbiome include changes in blood flow, circulating hormones, and intestinal motility. Exercise modifies the gut microbiota with positive health effects. An article in the Oxidative Medicine and Cellular Longevity says that exercise can be used as a treatment to maintain the balance of the microflora or to rebalance dysbiosis, thus obtaining an improvement of the health status. So what kind of exercise can improve our microbiome? Is it anaerobic exercise or is it aerobic exercise? Any kind of exercise is beneficial. As long as we move, we are much better off. But studies indicate that aerobic exercise is more beneficial for our microbiota, both in terms of increased abundance of beneficial bacteria and overall diversity. Cardiorespiratory fitness is a predictor of intestinal microbial diversity and distinct metagnomic functions. So CRF is considered a better predictor of mortality than clinical variables, including established risk factors such as smoking, diabetes, and hypertension. Findings are consistent with the role of physical activity in promoting gut-intestinal health. Further research needed on the use of aerobic exercise prescription as an adjuvant therapy in prevention and treatment of dysbiosis-associated diseases. So research was done on 71 premenopausal women ranging from 19 to 49 years, and it was found a positive correlation existed between cardiorespiratory fitness and beneficial gut microbiota composition. It showed that participants with low aerobic fitness had higher representation of potentially pathogenic Firmicutes and proteobacteria, independent of age. That means she could be a 19-year-old or a 49-year-old, and carbohydrate or fat intake. Let's have a look at the marathoners. So the fecal metabolites and microbiome of 20 amateur half marathon runners were investigated before and after a half marathon. The study showed a striking metabolic change in the gut environment after finishing a half marathon race. This study provides insight into the health benefits of marathon running from the perspective of gut microbiota for the first time. Hence, aerobic exercise can change the microbiota and the microbiota gut-brain axis to a great extent. But too much of a good thing can be bad for us. While there is no doubt that exercise has many health benefits, just like eating too much fiber, which is what is usually recommended, but when we eat too much fiber, it will cause unpleasant side effects. But similarly, prolonged strenuous exercise may also be detrimental to gut health and can lead to leaky gut, diarrhea, gastrointestinal bleeding, and bacterial translocation into the bloodstream. This is the cause of abdominal discomfort and diarrhea in many athletes while they are competing. So too much of a good thing can be bad for us too. Actually, we're supposed to make small changes. So studies show that even little changes can yield results. For example, increasing the frequency of moderate exercise from never to daily leads to a greater diversity in certain good microbiota. Let's have a look at some health problems due to dysbiosis. Diabetes and pre-diabetes. When overweight, pre-diabetic and sedentary men were made to exercise, the responders to exercise not only showed improvements in blood sugar control and insulin sensitivity, but they had a greater ability to produce short-chain fatty acids and to eliminate branch-chain amino acid. But in about 30% of the men, exercise did not cause a favorable metabolic response, a phenomena called exercise resistance. That is why we find that almost 70% of the people definitely show improvement in their blood sugar levels and insulin sensitivity if they exercise, but there are a few people who have to take medication in spite of the exercise. Yes, so exercise can improve the glycemic control and insulin sensitivity in the responders, whereas in the non-responders, they do not increase the glycemic control or insulin sensitivity. A similar experiment was done on mice when transplantation of the fecal microbiota of mice who were responders to exercise was given to obese mice. They mimicked the same beneficial effects as exercise on insulin resistance. That means these obese mice who received the fecal microbiota of responders to exercise, they also benefited from the insulin problem. Such effects were not observed after transplanting the microbiota of non-responders into obese mice, indicating that about 30% of overweight pre-diabetics do not respond favorably with exercise due to lack of effect on microbiota. Autism spectrum disorder. Several noteworthy reasons to consider that the gut microbiota may be involved in autism. The significance of frequent GI symptoms in autism spectrum disorder patients, the apparently distinct gut microbiome of these children compared to normal children, the higher incidence of antibiotic usage in individuals with ASD. For example, they frequently get otitis media and therefore antibiotics are used more frequently in these children. Many more of them may be born by cesarean, that may be one of the cause, and reduced breastfeeding could be another cause, and low fiber intake. This was a revolutionary, I would say, experiment done in Arizona State University. And for this, only children with autism with severe digestive problems were included in the study. When the study started, 83% of the children were classified as having severe autism. At the end of the study, only 17% were severe, 39% were mild or moderate, and 44% were below the cutoff for mild autism spectrum disorder. So I would say that this fecal transplant into autistic children was a revolutionary study, and which reduced nearly 50% over a 2-year period. They did this study, and the effects of this for the 2 years. Exercise is one of the most effective therapy for those who have autism, and especially aerobic exercise therapy. So declines in physical activity is what is we discover with all pediatric physiotherapists know that as these children with autism age, their physical activity levels start declining, and 43% of them become overweight, and an astounding rate of obesity is seen in these children. So vigorous bouts of physical activity have shown positive behavior change in comparison to bouts of light or moderate physical activity in these children, and hence community-based physical activity programs where all of them do vigorous activity together is highly recommended in these autistic children. Alzheimer. The gut-brain axis could play a significant role in the development of neurodegenerative diseases. Exercise training and probiotic treatments could delay inflammation, ameliorate oxidative stress, and decrease levels of beta amyloids, thereby attenuating loss in brain function. Our results from this study confirm that physical exercise and the use of probiotics can ameliorate cognitive function in Alzheimer's disease via alteration of the microbiome. Studies suggest that the unique microbiome of people with Alzheimer's disease could be contributing to the progression of their disease through the gut-brain axis. Such findings in humans and mouse models point to the tantalizing prospect that restoring healthy gut bacterial composition could prevent or slow the development of Alzheimer's in at-risk populations. So yes, exercise can ameliorate cognitive function in Alzheimer's disease. Highly recommended work that all Alzheimer patients should be doing. What about atherosclerotic cardiovascular disease? Many studies have confirmed the hypothesis that supports the premise that physical exercise prevents atherosclerotic cardiovascular disease by modifying the gut microbiota and by alleviating systematic inflammation. Some intestinal floras may contain species that could ameliorate or benefit atherosclerosis by exercise. So in this study in the lipids in health and disease published recently says that they have confirmed the hypothesis that one way physical exercise prevents atherosclerotic cardiovascular disease is by modifying the gut microbiota and also by systemic inflammation. Endometriosis is also increasing the world over, and young girls are affected by it. The etiology and pathogenesis of endometriosis are still not very clear and under investigation. However, there is evidence that there is complex bidirectional interaction between endometriosis and the microbiome. Laboratory and clinical studies demonstrate there are indeed differences in the microbiome composition of hosts with endometriosis and those who do not have endometriosis. So the microbiome composition in people with endometriosis is different from other healthy, normal girls. A study was done and published in the Journal of Physical Therapy Science about the efficacy of exercise on pelvic pain and posture associated with endometriosis. 20 patients with mild or moderate endometriosis were taken in the trial, and all of them were confirmed having endometriosis through the laparoscope. They were investigated after 4 weeks, and after 8 weeks of exercise program, again through the laparoscope, and statistically significant decrease in the intensity of endometriosis pain after performing 8 weeks of exercise program was seen in these patients. This is my personal experience. Endometriosis patients have a lot of musculoskeletal overlay, and the pain is not only because of the endometriosis implants, but also because of the musculoskeletal affection because of the implants. And they do much better with a good exercise program. So you see how the microbiome affects the gut and the brain, and exercise affects the gut and the brain. And microbiome and exercise are also having a bidirectional relation with each other. So the take-home message today is that age, genetics, body composition, medications, the presence of disease, diet and stress such as sleep deprivation are some of the many factors that can impact the composition or function of the gut microbiome. Innumerable studies in the last 10 years have identified the phyla that are respond to exercise, firmicutes, actinobacteria, and the short-chain fatty acids producing genera from the firmicutes phylum. This may lead to the development of various treatment combinations, exercise plus probiotics, to ameliorate specific disease states. What are the implications for physiotherapy? Targeted exercise therapies can be used as a treatment to maintain the balance of the microflora or to rebalance them, thus obtaining an improvement in the health status of a person. As health professionals in the promotion of exercise and physical fitness, we should be educating our patients about this added bonus exercise delivers. And findings warrant the use of exercise prescription as an adjuvant therapy in combating dysbiases and associated diseases. The implications of these observations are manifold, and researchers are hopeful that this promising body of preclinical work can be successfully translated to the clinic and beyond. This could open the door for completely new preventive, diagnostic, and therapeutic approaches for various diseases. As we know, right from the womb to the old age, our microbiota diversity and composition keeps changing. And when there is dysbiosis at a young age, that could lead to neurodevelopmental disorders. And as we age, we could get neurodegenerative disorders with dysbiosis. So exercise has been known to cause health and happiness always. Exercise is the wonder drug we should all be on. So let's do it. Thank you.
Thank you, ma'am. Thanks a lot. It was a great.
Okay. Can you all see me? Hello? Hello?
Yeah, we can see you.
Okay. Okay. So if there are any questions, I'll have a look at that. most of them are about thank you and wonderful session, very interesting. I don't see too many questions though. Yes, it's a very new topic, and yeah, probably that's why I don't see questions. I
May
only,
I?
if anybody has, yes, Heta has asked if there are any studies on the gut-brain micro and cerebral palsy. Yes, there are, and but all this is so much in a nascent stage, and the early learning. You know, maybe it's only since the last 5 years or so that exercise is regarded as one of the factors that changes the gut-brain microbiota. So I think we need to have more research in this field to be able to tell us exactly whether exercise can radically change the gut microbiota, even in cerebral palsy patients. But yes, the first researches that are coming in are extremely encouraging. And I think as physiotherapists, we have more about it and what kind of exercise would help. Somebody has asked, gut, brain and health can be maintained with balanced food and exercise, right? Not always. There are many, it's a complex, can you hear me? Because, okay,
Yes,
so
ma'am.
it is a very complex relation. So exercise is one of the ways, a benign way, a non-invasive way, and definitely we should explore it much more. And of course, food is the other thing, which is again non-invasive and benign. So these two things combined, we should explore it more. So in a C-section and vaginal delivery, what's the difference? When a baby is delivered vaginally, they get the microbiota from the mother while they are traversing through the vagina, and whereas in a C-section, they get the microbiota from the skin of the mother. So for about 6 to 8 months, the microbiota are quite different in a baby delivered by vaginal delivery and C-section. But over a period of time, the microbiota change and become similar to each other. Ayurveda, yes, but I am not an Ayurvedic person, so I would not be yes. But in our Ayurveda, they have a lot of emphasis on the gut, and so I'm sure these are not new things, but only thing the research was lacking. Now research is coming in, so that makes a lot of difference to people like us who need the research to be sure of what we are talking. What kind of diet? I'm not a dietitian, but yes, probiotics and prebiotics are highly recommended to improve the gut microbiota. And we do not have measures in our country, as far as I know, to measure the gut microbiota as yet. So we would not be able to investigate it to the extent that some of these researchers talk about. Microbiome can be assessed, as I said, we do not have the sophisticated techniques as yet to assess the microbiome, but a diverse microbiome and short chain fatty acids is a good microbiome. I'm not too sure whether fasting would help in the microbiota health, but it is a subject that definitely could be researched Valerian. The dosage of aerobic exercise, as said, should be gradually increased. It depends. It is tailor-made to the person and to the physical and mental attributes of the person. So there is no general dosage of aerobic exercise for every gut. We're all made differently, but a gradual increase of the aerobic exercise has shown a lot of influence on the, in a positive way, on the gut-brain axis. I'm not sure whether there are any researches on the fatty liver, but as of now, generally they say that aerobic exercises helps in more than anaerobic exercise in most cases of gut microbiota dysbiosis. I'm not sure about the fasting, Dr. Ashok Kamdar. I'm not sure whether fasting helps because I don't know if there are any studies on them. So what is the minimum time to get the positive result? So these marathon runners that I talked about, half marathon runners, their microbiota was tested before and after the run, and immediately they showed the positive result. The microbiota composition changed immediately after the run. But in many cases, there are other studies which show that once they go back to the sedentary lifestyle, the microbiota change again in opposite direction. So, so they may get the benefit with exercise, but like in all other things, like our muscles, which do well when we only exercise, but when we stop exercises, our muscles start atrophying. Same thing with the microbiota composition and diversity. Once we stop exercising, they could go back to our dysbiosis again. Professor Senthil Kumar has asked whether I am a member of APTA. I am a member of Academic of Pelvic Health, which is a branch of APTA. And the certification in pelvic floor health physical therapy, there are many courses that they offer. Each of them, we have to go through a case study exam, a practical exam, a viva, and 50 questions MCQ. And once we go through all of that, then they give us the certificate if we pass all those exams. So that's how you get the certificate.
Great, ma'am. Another question has come.
Yeah. Relationship between microbiota and menopausal symptoms? Yes, probably. As we age, our microbiota diversity definitely starts decreasing. So if we don't continue exercising to the level of our health and physical attributes, we will show a decline in the diversity of our microbiota.
I think, ma'am, that's about all questions.
Yeah.
Thank you, ma'am.
Yeah.
It was a great, wonderful, fabulous session, knowledge sharing session, excellent session on a new field, which is very interesting and needs great research. And it is good that you have pioneered us in this new area, so we can start working in this relatively newer field and find more avenues for developing physical therapy in this field. So that's a very interesting topic, ma'am. Thanks a lot for your excellent sharing, knowledge sharing.
Thank you. Thank
Any
you
other
so
questions?
much, Dr. Brijesh Kapoor, for
Yes, ma'am.
giving me this opportunity. And as I tell everybody, anything for the profession. I have a passion for teaching, learning. I'm a little crazy about learning, but I love to learn and I love to express everything that I've learned at some platform. So thank you for giving me this platform.
Thank you, ma'am. Thank you very much. It's very kind of you, ma'am. You are very passionate about the profession. We very well know, ma'am. We all share the passion, and that's why we want to learn more and more.
Yes.
So we are very thankful to you, ma'am, that you have given us this valuable opportunity to learn from you, so that we can start thinking in this new area and add our dimensions as a physical therapist in this new field. Excellent, ma'am. We would look forward to having, ma'am, more sessions from you and request you would for the same. Thanks a lot, ma'am. We are very much obliged for this.
Thank you.
ma'am.
Thank you, all those listening. I can't see you all, and I know that you all are muted. But thank you so much. It just, without an audience, there is no fun. And Dr. Brijesh Kapoor has worked hard to inform all of you. And also, so thank you so much for your silent listening and your participation. And thank you, Brijesh Kapoor, again.
Thank you, ma'am. Thank you very much to all the participants for the wonderful participation. Thanks a lot.
You can show your videos now so that I can see your face. Hello, Divya Ben.
Yes,
good to see you.
Professor Santhil was there.
I can see a lot of familiar people. Heta, hi. Hello. Hello. Hello, Dr. Vivek Gupta. Hello, Kesha.
Hello, ma'am.
Vikram Kumar. Hello. Hello. Shalini. Hello.
Hello, ma'am.
Hello. Hello. How are you all? You can unmute yourselves now. We'll just 5 minutes. We'll just say hello to everybody. It's so nice to see all of you here. So, Prabir, you can unmute them or allow them to unmute.
Yes.
Thank you, everybody, for your enthusiastic participation. We are very thankful to all of you.
Yeah. There's no show without an audience, right? So we
Yes,
are
ma'am.
equally thankful
Definitely.
to you.
Everybody is very enthusiastic in learning, and that is why they are here.
Right.
It's a good thing.
Hi, Pooja.
The more we learn, the better we become. And I think there is no end to learning.
Absolutely, absolutely.
I still feel I would like to learn till the moment I die, as much as possible.
Right, absolutely. Right.
And we wanted to come on screen because madam was telling that she couldn't see any of us. Okay,
Yeah,
but
yeah.
anyway, my video is blocked anyway.
Dr. Santhil is also very passionate about the profession. So.
And
Yes.
actually, madam is an inspiration, actually.
Ma'am
That
is an
passion to
inspiration. I
learn.
keep telling to
Okay.
ma'am that she is an inspiration to all of us.
And
That is why we
being
keep
one
trying
more important
harder
thing is
to,
that lady physio, okay, being an icon of such a level and then doing work like this in pelvic floor health in global magnitude. Okay,
Great,
whole India
great.
is looking upon madam as a leading inspiration. So it's
Thank
always a
you.
good experience listening to her.
Is a
Thank you.
great
So nice
inspirational
to
figure
you.
for all of
Kind
us.
you. Hi, Madhvi. Hi. Madhvi, you can unmute yourself. Thank you, everybody. Madhvi, I can't hear you. I know you're talking, but I can't hear you, Madhvi.
It's a nice lecture, ma'am. And thank you
Thank
very
you.
much for this. Thank you very much.
Thank you, Madhvi. Thank you.
Yeah.
Thank you. Okay. I don't.